In this video, we're going to be talking about uveitis and what this means for your eyes when they're acutely inflamed or chronically inflamed. Uveitis is an inflammation of a certain section of your eyeball. It can be in the front of the eyeball, it can be in the middle of the eyeball, it can also be in the back of the eyeball. But what happens in uveitis is due to certain conditions and certain traumas and different scenarios, the eyeball can be extremely inflamed and it can send a lot of pain signals and it can cause a lot of issues with the eyeball that compromise someone's vision. And it usually happens in one eye typically, specifically related to five health conditions that can promote this condition of uveitis. So we typically like to refer to this as the UCRAP mnemonic. And it sounds kind of weird when I say it, but there are actually five conditions within that UCRAP mnemonic that cause uveitis. So we're going to start with the first one, which is ulcerative colitis. This can actually spur up uveitis or anterior uveitis, intermediate uveitis, or even posterior uveitis that has a connection with the gastrointestinal digestive tract, that if there's inflammation there, it can actually inflame the eyeball as well too. The second condition is referring to Crohn's. And with Crohn's, it's a very similar but different areas of inflammation in the GI tract that can actually inflame the eyeball if there's an autoimmune or an immune inflammatory flare-up that causes this condition to kind of egg up and get some irritation going in other areas of the body, but specifically the eyeball in this case. The next one is reactive arthritis. And with reactive arthritis, it's pretty acute. It's inflammation of the joints, the fingers, the knees, the toes, different areas where there's like bone joints. Those areas can be inflamed and actually can cause some irritation of the eyeball as a secondary byproduct result of that condition. Probably a more common one, the A of this mnemonic, is called ankylosing spondylitis. This typically has to do with lower back pain, specifically in the spinal cord and in the vertebrae, often affecting males more than females, but really it can affect anybody, honestly. And the last one is psoriatic arthritis, which psoriatic arthritis, obviously psoriasis mixed in with arthritis, can lead to inflammation of the eyeball specifically. You can also get uveitis in the acute form, which happens very quickly, or you can get it very chronically associated with any of those five conditions I mentioned just a few moments ago. What also can happen is if you get punched in the face, or if you experience some level of trauma. What if there's a car accident? The eyeball can be damaged, and what happens is the ciliary body, it is a muscle surrounding the inside of the iris, the color portion of your eyes, that actually can become inflamed and damaged and release a lot of plasma, white blood cells, even red blood cells if the blood vessels are damaged for that matter, and can lead, and protein in the blood as well too, that can lead to inflammation and light sensitivity and pain, because there's actually only two areas in the eyeball where you can experience pain. Do you happen to know what those are? The first one's the cornea, the front of the eyeball. We've talked about it in previous videos, but it sends a lot of pain receptor nerve signals to the brain, and it's highly innervated with nerves that send those signals. That's one area. The other area is the ciliary body. So the ciliary body is that muscle, and it's responsible for mostly producing the eye pressure of your eyes, the aqueous humor, as well as constricting and dilating your iris for the pupil, the black hole in the middle of your eyes. But those are the two areas that are responsible for sending pain signals to the brain. So when there's uveitis, it's often very common. You experience a lot of pain, a lot of redness, a lot of irritation, light sensitivity, decreased vision, that you'll want to get in touch with your healthcare professional about in order to get you on the right prescription eye drops, see the right healthcare professional. If there needs to be a systemic workup to identify any of those five conditions or other conditions that can be affiliated with it. Those are just the five most common ones. There are a laundry list of other conditions that can cause uveitis as well too, but those are just the five common ones I typically run into when I talk with patients. Uveitis is extremely important that you be aware of it. If not treated in an appropriate amount of time, can lead to permanent vision damage of certain areas of the eyeball that can be saved in an appropriate amount of time and treated appropriately, because it's miserable, it's frustrating, it's something you don't want to experience long term if you don't have to. But if it's something you need to manage with one of the systemic conditions that you're dealing with as well, just make sure you work with your healthcare professionals in order to get the best treatment and the best care and the best plan of action in order to keep those conditions at bay and as stable and as calm as possible. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington. We'll see you next time.